Okay, folks, we're a few minutes past 10 and people are still coming in, but there's a reasonable number okay already. I'd just like to welcome you all this morning and say that we are recording this, and the recording and the presentations will be on the website fairly shortly. The key message today is around CQC close, and we're very fortunate to have Tina Stebbings with us, who works for Fulcrum Care. Tina has long experience in social care. I'm sure she'll tell you that herself. She has been a registered manager. She's worked for organisations large and small, worked around the country, and is now a lead at Fulcrum Care. What actually prompted the meeting was discussing with CQC their quite shocking findings in reports, and that the basics are being missed by many, many care providers. So we're talking about things like IPC, health and safety, recording of evidence, and it apparently has been quite a shock to CQC in the actual reports they're doing, the inspections they're doing face to face. And has caused a great deal of concern. And as they're altering their inspection regime, these are things that need to be got right. And as many of you will be working with local authorities, you will be tendering to local authorities. Having a requires improvement may well rule you out of being able to tender. It will also cost you more in insurance, and may well affect your business. And as we're seeing some local authorities now requiring people that bid to them having to have a turnover of at least £10 million, that may well rule some of you out anyway. As well as Tina, we've got Skills for Care with us today. Skills for Care have got an awful lot of information available on their website to support you. And as well as Skills for Care, you can also access useful information from the likes of Sky and from TLAP, NICE, etc. And you've also got access to the likes of information from Fulcrum, from Citation, and people like Purple Tribe. And I think Dudley's got a few words before we hand over to Tina. Dudley.
Morning, everyone, and it's glad to see a nice turn up, and really everyone just trying to find out what's happening as that's going on in social care. There's been a lot going on. I was managing to speak to Sina from Skills for Care earlier. Lots of events, lots of things taking place. And I think the backdrop, and I think what most people are being concerned about, and I'm sure Peter will touch on this, is around funding and where we stand in social care, what's happening from that point of view. I think what we've been trying to do is to try and also update you, which we do at LCaS, be it via email or WhatsApp, of what to look out for, and not just technology, but how to keep well and so forth. So do try and keep up. We know it's not just CQC, which is really important today, but all factors, recruitment, retention, and all the sort of issues that you're actually facing on the ground level on a day-to-day basis. So really keeping in touch, not just with us at LCaS, we've got Skills for Care, and part of the WhatsApp groups and other areas is to speak to those people locally as well. It's important to actually keep in touch, because there's a lot that might be missed. There's lots of free training that's been available, access to meetings and updates, which we all can actually, if you can't go there, send in maybe a deputy or someone in your team to actually find out the changes, and other things such as what's going on with the capacity tracker and deadlines like this. So all these things are unfortunately a lot of information, which is also vital for our services. And I think one of the points today we're saying is that with all so much that's going on, a lot of things are missed, and the basic things are being missed. And that's why CQC are actually coming down on organizations, because they're actually missing the basics. So really and truly, it's really important to keep updated. It's not just COVID where we're just being updated and we kept on it. This is part of your job, and part of what your organization's role is to do, is to really keep on top of it. It's not the easiest thing to do, and it's not ideal, but it's something that just has to be done. And the easiest way of doing it is really by just trying to be in touch with various organizations and kept up to date. Outside of that, I'm not sure if people are aware, it's self-care week, and it's a finding that a lot of the workforce who are leaving the sector have been under pressure, and their mental well-being has been one of the things that's been really has come off the back of the COVID and the pandemic. So really taking care of yourself is important, and really trying to see if you can help your teams as well to keep on top of everything. I put in the chat, the Department of Health and Social Care have released also a self-care update this week. I know Skills of Care have as well. And it's a social care blog of the things that you can do. So please do also speak with your staff on how you can help them. There's lots of training and awareness that's available. And also as well, please do try and put some basic things, such as if you are doing reviews, probably trying to spend time to ask your staff how they're feeling as well. So I think that's really important if we're going to try and help to retain our staff.
Yep. Just a quick interruption, Dudley. On if you're looking for information about supporting your staff, there are two excellent Keeping Well portals available to you. One is basically for South East London and one is for North West London, but don't take any notice of those. There should be, each ICS should have their own, but those two are far ahead of the others. So just use the North West London and the South East London ones, and you can access their chat, their information, everything. They are very good. There's a huge pile of information there. And in North West London, we'll have another raft of free training available very shortly. The dates have been fixed. I'm just waiting for the flyer to be passed on to me, and we'll circulate that. So if you're any link to the 8 North West London boroughs, that's a pile of useful free training for you and your staff.
Thanks for that, Peter. I think I would say on top of it, I've been involved heavily with some of the Keeping Well portals, and one of the things that we've looked at is actually to try and change the dial. Instead of being focused on the NHS, it's also been looking at social care. So the language, how it's been looked at, is also very important. So we're trying to look at that to support those. So I think Celine's put something in the chat. I'll put some of the actual links in the chat. You can go into them and have a look at them as well. I know even though we're London-based, we've also looked at the whole diversity and the culture of being in London as well. So we've tried to adapt it to the workforces, and Sourcing will tell you the workforce demographics as well are really important. So we've really looked at that as well. So thank you. I think apart from that, I think there's do look out for any sort of funding that's available. Do speak to your local authorities and the ICSs around things such as digital funding. If you haven't got on board, there's a lot of free funding for technology and digital technology, and also self-care and anything around that. And Peter, over to you.
Okay, thanks, Dudley. Brilliant. I've put links to the 2 Keeping Well portals in the chat, Southeast and Northwest. As I say, just use them. And we're delighted that Tina's joined us from Fulcrum this morning. So Tina, over to you. The floor is yours.
Thank you very much. I'm just going to try and share my screen. If I can't, I do have a backup plan.
Tina, very quickly before you start, people may ask questions, I'm not sure at the end, but if anything during the session, you can either put a question in the chat box, Tina may answer it at the end, or have a question for her at the end if you want to, whilst Tina sort of gets herself prepared, just to make people aware.
Great, so hopefully, can everybody see my screen? I think, is it working?
Yes.
Good, fantastic.
Yeah, I can see.
Okay. The first battle over technology has been won. Okay, so my name's Tina. I'm the business manager for Fulcrum Care. Fulcrum Care is a consultancy service that supports care providers, but predominantly care managers, care registered managers. The majority of our employees have been registered managers. We know what you do. We know the struggles behind it, and we are there to support. We have sort of three main strings to what we do. We have the reactive service, which is you get an adequate CQC report and you call us and we come in and help you to turn that around in whatever way in whatever way we can. Lots of different varieties of that. It might be having one of our consultants to actually come in with you. Your inadequate might be a particular area that needs work, so we can get specialist consultants to work on that, sometimes remotely. And that's really the sort of turnaround service. And that can be anything from a month to sometimes up to six until CQC come back in again. The next bit that we do, and we do quite a lot of, is the mock CQC inspections. We have some specialist consultants who will come into your services. Majority of the ones we do, they are actually, you know it's going to happen. So it's not like a CQC visit as such that they can turn up at any time. For hours, usually people are prepared for it, but it will follow exactly the same format as CQC, and we try and give you a really accurate idea of that day. A CQC inspection, as it is right now, is very much about that day. However, you know, we do tend to have a very accurate picture. We do find that when CQC come in soon afterwards, that they have found the same things that we found, unless it's been put right quickly. And the other bit that we do is we do managed services. So we look after people, investors buy services, and we put in our operations team to support the home managers or registered managers to look after those services. Fulcrum is across the whole of the UK, and we have a spread of consultants across that whole area. So what I wanted to talk to you about today is Peter and I were talking about what CQC have been finding, and we're finding exactly the same problems that CQC are finding. And I think what we've found, if I say since COVID, I think we were all locked away for 2 years really, and without any eyes on us and without any support, and we just had to manage in a locked room almost. And I think that's been a real problem. And going forward, I think we sort of almost have to get back to where we were before then. Our view of it is that we have slipped. And I say we because, you know, I'm at heart a registered manager, even if I'm not. Okay, so so CQC have noted. I'm not going to read my slides, like you can do that, but I'm just going to talk through them. So yeah, the basic stuff that all of us used to get right, and it's the same stuff that we're getting wrong, and it is the stuff that, you know, we all want to achieve that dream outstanding or good across the board, and I think what's happening now is that we're trying to achieve that top bit without getting the bits at the bottom right, the basic building bricks of what we do. And there does seem to be out there a massive lack of understanding of the basics. And when I say the basics, I'm talking about, so good old Maslow here, we always bring out, don't we? He's a it really is a case of, if we don't get those bottom bits right, and we don't get those basics, and the basics here, I'm talking about the Chloes, I'm talking about the basic building blocks to getting a good and to being valued by the local authorities, and to being valued by the private private customers. If we don't get that bit right, we cannot move on to the self-actualization of care home management, which is probably that elusive outstanding. So that's really what I'm going to be doing. You know, we cannot move up to the next steps until we've got that basic bit right. So if we don't get it right at the bottom, the top bit falls off. So this is where we're going. So I'm not going to bore you with the Chloes. However, I am going to sort of point out, for instance, in SAFE. So we're looking at safeguarding, obviously. we're looking at each one of these Chloes. This is how we inspect, and it's how CQC inspect. We actually go through each Chloe and we find the evidence for each one. It's exactly the same process. Obviously, next year things are going to change slightly. However, we've still got the same regulations in place, so it's not going to change a huge amount. You still need to do the things you always needed to do. So we're talking about safeguarding, which is a massive part of what we do. We're talking about safe staffing, medicines. Medicines have been a massive problem. That is something that really has a big difference there since before COVID. Infection, obviously, I do believe, I may be one of the few that believes we've got far better at infection control, because I think that the experience has helped us with that, and the training that we've done during it. Lessons learned, that's a big one, and that's something that again, we're not doing brilliantly at the moment. Okay, so this is what we're finding time and time again, and almost in, I would say, if we go into a care home to do an inspection, these are the things that we pretty much check, because we know we're going to find problems there. Now, if our consultants come into any of your homes over the next few months, then you'll know where we're looking. References and DBSs. DBSs is just, not finding the evidence for a DBS, and in some cases, when investigated, not actually having a DBS in place is quite commonplace. Gaps in employment, that's and nurses' pins tracker. Those sort of things, we're seeing that quite a lot. Medication, a lot of people in the last couple of years have started to use technology for medication, and when used well, that is really improving everything. I think the lack of oversight is the biggest issue. The fact that when we go in and we find stuff, sometimes the manager is not aware of that, and sometimes the manager hasn't been able to get that oversight. So no auditing, competencies, things that we ticked off the list quite easily, but those things are not stuff that we should be missing. Safeguarding, investigations, not evidencing lessons learned. That's the biggest one. And also that when we go into a turnaround home, a home that's inadequate, we often find that the safeguardings, there's a lot of them, and they're all raised by external people. When we start to see that turning around, there might be as many, but they're raised internally. And that's something that is really positive, that the homes start to raise their own. Okay. So for effective, again, the effective needs and choices, making sure that the service, that the staff have the skills, knowledge and experience. Again, that links in very much to those staff that are delivering a specialist service, those staff that are giving medication, that they haven't got the training and competence to do that. Eating and drinking, how well staff teams work across other organisations. And I think, using an organisation like this, like Skills for Care, those people that are out there to help you and to support you as a registered manager, really, really important that you do use everything you can get. It's the toughest job in the world, I believe, and I know people will argue with me, but it is something that you need help, and you need to ask, and don't be frightened to ask for support from everybody. There's lots of experts out there that can help you. So yeah, then we go on to individual needs, adaptation, design and decoration. That the premises don't tend to be too much of a problem. We don't tend to find too much problem in that. Consent to care and treatment, that does tend to be a bit more of a problem. So what we're finding, MCA, the understanding of MCA within care homes, especially when we're talking to those staff on the floor, is still not great. I mean, I've been around a long time. I've been a registered manager within private and corporate and charitable organisations, and I know when it came out in the first place, we were all bombarded with the training, but I still don't think there is an understanding of mental capacity and assessing mental capacity as there should be, which means that we are not actually building care plans around assessments, and that's a real theme. Seeing care plans that are beautifully written and lots of content and lots of information, but then seeing risk assessments that have been done that are not balancing with that. So, you know, if you're using a system that is allowing you to develop the assessments first and then feeding into the care plan, that's the way it should be done. But we're finding that a lot. Training's done, but the evidence of it is in most of the care homes that are certainly inadequate. And bear in mind, we go into a care homes because the provider feels that we're needed. So we don't necessarily go into the good, outstanding homes very often. So when I'm saying that we're finding all these things, these are in care homes that are needing our services. Consent, the evidence in records for consent is not there sometimes, and certainly day-to-day interactions, even knocking on doors, you know, basics, just kind of come in, you know, we're finding that. With caring, I think a lot of the care home managers find it difficult to evidence. It's not. It's about the way we see it, training your staff to make sure that they understand how to deliver care with kindness and compassion, and then it's there, it's visible, and you will get feedback from your residents, but also making sure that your residents are able to express their views and massively involved in making decisions about their care. In the homes we're going into, it's been done to them, not with them. And that is something that I thought before COVID we were starting to get there, and we're not now, I don't think. I think we are, you know, we need them involved in the running of the home, involved in what they do. So with caring, we've got a lack of evidence of residents being involved in decision making. I'm not saying it's not happening, but it's the evidence out there that we're not pinning down very well, and we're not evidencing that what we're doing. And decision making and involvement in the running of the home. So residents forums, residents meetings, making sure that the residents are right at the centre of everything, every decision that's made. If the residents aren't planning your menus, then I would say, why? You know, it's not your menu, it's theirs. Decision making in their own care planning. Now, I think we were getting better at that, and I think that slipped off as well. And showing adaptive ways of making sure that people can be involved, however they can be involved. Okay, so responsive, again, with that, making sure that they can understand what we're doing, what the home's doing, where they are, what we're doing for them, and also look at making sure that everything's AIS, everything that you've got, you can present it in a way that they can understand it. Complaints are a great way of evidencing, and certainly going forward into the new year with the new way of working for CQC, your complaints and the way you handle them is going to be a really, really good tool for you to evidence the way that you've done. One of the things that we are finding that is great in most care homes is end of life care. I do think over the years we've all got far better at that. And I think when we talk to people that have died in care homes and their family, we don't talk to people that have died. When we talk to the families of those people that have died in care homes, we're understanding that they've had a really good service, and that is something that I think we do very well across the board. So where we need to improve here is accessible information standard. So not communicating to our residents in a way that they can understand. So, and we see that lots and lots when we're doing the mock inspections. adaptive ways of passing on information about the home. So making sure we look at what their communication needs are and making sure that that communication need is catered for, however, whatever we have to do for them. Complaints. The good homes will have concerns, but they won't go into complaints. Or if they do, they go into complaints that are fully supported and have a great outcome and lessons are learned from what happens. There are always problems, of course there are, but it's the way, it's not what happens, it's the way we deal with it. Okay, well led, clear vision, credible strategy to deliver high quality care. The clear vision. If I was to go into most care homes and ask the staff what the vision of the care home was, they wouldn't know. In some of the good care homes, we've got evidence of that in all sorts of different forms, in staff rooms, on apps, but the not knowing what we're all there for and what we're doing is it's not helping the people that are working for us to work with us, and also for the residents and their families to know what we're there for and what we should be doing. The governance framework, really to ensure that responsibilities are clear and understood. Governance has been a big problem, and duty of candour, and how the provider understands duty of candour. How the people use the service, how does the service continuously learn, improve and innovate? That's a really good one. And how does the service work in partnership with other agencies? Next year, these are going to become massively important to us to make sure that we can evidence all this and make sure we feed CQC with that information. So these are the things that we find in Well Led all the time. Sharing the vision and strategy. So lack of evidence, and sometimes it includes the senior management. If you know, it's not just the carers on the floor. It does sometimes include the senior management. The governance framework not well managed, audits not carried out in line with policy timelines. I think it's always a good idea to check your policies, because if you are, you know, you can change your policies in line with what you're actually doing. Your policies need to match, and very often they don't. Action plans for audits not reviewed and completed, and audits being treated as standalone exercise and not a way of identifying things that need fixing and then fixing them. So it is making sure that you are following that. So what I want to say next is, okay, I've just said a lot of what sounds like very negative stuff, but what, you know, some of you are sitting in good care homes and you'll say, yeah, okay, we're doing all that, fine. But what I'm trying to say is that there's an awful lot of care homes out there now, and more than there were, who are not, this is not working for them. And they are, you know, they're failing, and we're getting a lot of inadequate care homes, which, you know, that causes a huge amount of pain, heartache, expense for the residents, for the staff, and certainly for the providers as well. So it is about going back to that basics and making sure that we're looking at the Chloes ourselves, and we say, are we doing that? Are we missing that? And I think one of the other things we're finding is, even in the good homes that are doing amazing work with you know, activities and with working personalization with the residents, we're still finding some of that basic stuff missing. So I hope that hasn't been too negative, and I hope those of you sitting there in care homes have not thought, oh, for goodness sake, we're not that bad. You're doing an amazing job. It's just that I think what's been noticed is that we are slipping backwards. And yeah, I'd be happy to take any questions if I can work out how to get it back out of here again. Okay.
I think there's a few points in the chat.
Okay, let me get back in.
And I think to answer one of those questions, many of those points do apply equally to dom care providers?
Absolutely, yes. We do look after dom care providers too. We've got a group who are a massive supported living organisation in the country that we're looking after three of their areas at the moment in turnaround. You know, the Chloes are the Chloes, wherever we are, you need to interpret them for your own service. I can't see the chat, just a minute. Would you be able to read the questions out to me, please?
That's fine, Tina. It's not a problem. I think a lot of people are saying really thank you very much for the session, and actually whether the slides can be shared. And I think we will be sharing the slides as well. And Tina also be leaving her details. I'm not sure if you can actually put it in their chat as well. So actually people may be able to contact you as well. I think that's another thing that I think people would like to do. I think you mentioned quite a lot there, Tina, and I think one of the things, as you mentioned, is that we've done really well during the pandemic and during COVID to actually really do some amazing work that, as you mentioned, it's the simple everyday things that we do, the crossing the T's and dotting the I's, which we also can't forget are the ones being missed. You mentioned things such as, I know a lot with turnover of staff, the gaps in your actual recruitment is something that probably is not your fault, but when the staff turns over really quickly or you've been put through, it's something that you just get them on to work and then you actually miss something small. So I think there's things like that. I think there's someone who wants to ask a question in the chat. I'm not sure if the individual put their hand down.
It was Amazing Angels Care.
What a fantastic name.
So amazing, I'll say amazing. The floor is yours, Amazing.
You're on mute.
Oh, sorry. Can you hear me? Hiya. Sorry, I put my hand up by mistake, but I'll say something anyways. Just wanted to say thank you for your input. We're a new organization, and what you were saying really applies to us. We are a domiciliary care agency. So we're here to learn and keep our organization within the CQC and to keep the best practice. Thank you.
No problem at all.
And now Alison Wright, please.
Hi Tina, thank you so much. It was really informative. I also work for an agency who does home care support, and so I find it quite hard to engage all of our workers because we've got so many, they're all out on the road, we don't get to see them very often. However, we touch base with them with newsletters and stuff. But where you're saying about signposting things, making sure the message is getting through to them via staff rooms and stuff like that, because we don't have staff rooms or any common areas, how would you suggest trying to make sure that everyone's on board? Because we send emails out, we send text messages, but you know what it's like, people have busy lives, they don't read them. So it's about how to sort of get all of our staff together so that we can sort of just make sure that all of their well-being is okay and that they're understanding the message that we're trying to portray with the care that they're giving.
Yeah, I think a lot of our domiciliary care providers are using apps. They're using rostering technology where they can get information from their phone and then input in the staff handbook on there with all the stuff that they need to know about and contact details of everybody. Obviously, you can do with this sort of communication, we've all got very good at using Zoom and Teams and whatever. Getting them together on that at some point is good. One of the community care organisations that we're turning around at the moment is moving into using, they're doing Teams meetings with all of their staff. And also, if your managers go out into the services too, and your managers go out and work with those staff and meet with those staff, not just because there might be an issue with some of that. Sometimes with the home care providers, we see managers going out when they think there might be an issue in an area, but not just going out and saying, hi, I'm your manager, I'm just going to come out and support you for the day and be with them for that day. That works really well. And also your feedback is really important. So from next year, really important that you get your staff feeding back to you about the quality. So making sure you're doing your staff surveys and then acting on those issues that are coming up.
Yeah. Okay. Brilliant. Thank you so much.
No problem.
I'm not sure if there's anyone else who wants to ask a question. I would. There's a Fumni who wants to ask a question, please.
Yeah. Hi, everyone. Mine's just to add a little to what Alison said. I raised my hand earlier and I had to bring it down when she mentioned the team meeting. I'm just going to add a bit on it because that's what actually works for me. Like you said, Alison, I can feel you very well because it's really difficult to get, but I'm in the domiciliary care, Dominion Care Services. So it's usually very difficult to get carers together to update them with things. So what we do, because we just had our CQC inspection in July. So, and one of the things that really helped us out, that one of the things they credited us for was the team meetings. Well, because what I do that has worked, because getting them together can be a hell of trouble, trust me. So what I do is, one, the team meeting, like she rightly mentioned, which we do in groups, because even with the team meetings, it can be very difficult to get everybody together on board at the same time to be able to update them with information. So what I do is I put them into like 3-4 groups so that it's not the time that is going to clash with their time they have visits. Of course, you can't have all the carers off the field. So we do team meetings, have a record, the same, any information, all informations you want to gather, we give to them at that time, the handbills, remind them of the policies, everything you want to say, you get ready. So dividing them in groups and sharing the same thing. The group meeting, sometimes I remember the team meeting, I usually fix it the first Monday, Tuesday of every month, the first Monday or Tuesday of every month. Because once you fix a particular day, of course, your calendar is in your calendar. So for those you can see on Monday, maybe you can do 2-3 meetings on Monday. It can be hectic, but it's better and safer for you. Or then Tuesday, you have the other group and make sure the same thing is passed around. It's a forum for them to have to answer their questions, whatever challenges they're having, they can discuss with you. That's for the team meeting. Then another thing which our inspector was happy about was the supervision. During the supervision, that's another time, you have your supervisions regularly, the one-to-one supervision. So that actually helped us as well to be able to communicate things. So by the time the Care Quality Commission was calling our staff, most of the things that they were asked, they're already aware about our policies. And I will tell you for free, that was what really helped us. Team meetings, supervision, and going out to see them, not just if there's a problem as well, just like a spot check or quality visit. It helps. Thank you.
Yeah, that's really good, and making evidence in that. It's going forward, we are going to need to be providing CQC with all of this evidence going. So having it set, and great idea to have a date. I did see there was a question back here somewhere from somebody about internal, external safeguardings. What I was trying to get across from that is those homes that we see that are inadequate are getting lots and lots of safeguardings, but they're not raising any themselves. When we turn them around, we might still be having the safeguardings, but they're coming from us, well, from the home, rather than from the external people that are visiting the home. Sorry, anything else? Yeah.
Just to remind you, and I think that people always whistleblowing and safeguarding, as if you're trying to avoid it, to think it's a bad thing. Actually, safeguarding can help you and your organization improve and actually see what can be done. So rather than always seeing it as a negative, can also be deemed as something which you've showed there was an issue and a concern, and this is how you fixed it, and you showcase that as well. So I think also a lot of organizations can do that, or they're obviously constantly trying to avoid the tag of the safeguarding on you. But it can show improvement and where you've been. And I know that CQC do like to see what organizations have achieved and what compliances or things they've done and put in place, which I think are really important. One question I want to ask you, Tina, I think is something going forward, is there's a lot of transition now into digital technology. And I think people are trying to be more adept with it and how. So I guess how would that work now with, I know you going into services now with different types of software, how do they showcase that good things that they're doing onto technology? I guess would be a lot of the queries that people will ask.
Yeah, a lot of the care planning technology, for example, is really excellent. I mean, I was, oh goodness, probably 25 years ago. My first inspectors were the local authority anyway, so a long time ago. And in those days, everything was written. A care plan was on one sheet of paper. I remember having a care plan for each person on one sheet of paper. And I think what some of the new technologies, I'm just trying to think whether I'm allowed to sort of mention specific. Yes, I will, because we've used PCS.
I mean, Tina, you can use that. I mean, there's the a short suppliers list, which I think which has been brought out there by NHSX, and as you said, there's various suppliers on there being
we've used PCS a lot, and we've actually introduced it into care homes that are inadequate and supported the staff team with it. And that is a particular system which works from developing fantastic pre-assessment assessments, individual need assessments, and then linking to the care plan, so we know what to write in those care plans. And I think then what we do, what the care homes do for us, is they give us access to that, and we can audit it as CQC will. And CQC will ask you for access, and they will go in and they will go in and look at your care plans. I think something like that is very easy to update, and you haven't got the duplication that, I mean, you all remember those days when we had to write everything about 6 or 7 times to evidence it. And I think with the new systems, that's one of the things they've solved for us. Does make things a lot quicker and a lot more efficient.
Yeah. One thing I would just say to add to that, Tina, I mean, whether people use, whatever it is, PCS or Care Visions, whatever, there's some really good stuff out there, but it isn't magic. People still have to put information into it. Yeah. It doesn't go around and gather it up on its own.
No, it doesn't. You're right. You're right.
Alison, I saw you had your hand up. Was that a legacy hand, or was there a question?
No, it was a legacy hand. I just couldn't find out how to lower it.
I see there's also a question in the chat about recording things like knocking on doors. Are you meaning it's not there generally in observed care?
Observed care. When we go into care homes that are, and you must remember, I'm going into the inadequate care homes mostly, and it's very different, but we very seldom see a knock on a door and wait for an answer, or even a knock on the door. Lots of people walking straight in, and that's a really easy way of evidencing consent when CQC are actually in the building, or when anybody's in the building.
Yeah. There's also a question there. When you say medicine is a big problem, can you explain why? Can I just add to that? The one thing that keeps coming back is around topical medicines, hand creams and stuff like that aren't prescription, and linking them into health and safety, because some of them are flammable. Mm-hmm. If you've got Fagash Lil and she's got half a gallon of something flammable by the chair arm, it's not going to end well.
No. So with medicines, the main issue is people not following procedure. People still potting up after all these years, still doing things that are cutting corners as they see it, but really causes a huge amount more time and problems in the future. Usually in the care homes that we go into, a turnaround, because when we do a turnaround, we always do a mock inspection first. So we've got the basics, and we almost always find medication errors that haven't been found. And I'm not saying that technology stops the errors, but as long as the technology is followed, I think what we found with some of the technology is that you can tell as a manager if all of the medication was given in a round of 20 people within 3 minutes, they're not doing it properly. they're doing the medication and they're going back and filling it in. So for a manager who's overseeing it, if they are overseeing it, they can see quite clearly if an electronic system is not being used safely and within the procedure. And I think that's one of the things we're seeing. It's clear to us it's not been done properly, but the manager or the clinical lead is not aware of that. So yeah, it's about administration not being done correctly. It's still about missing signatures, even in, you know, yes, we can count and we can see that medication's been given, but there's no evidence it's been given, and therefore it hasn't been. So it's back to the basics of getting the medication right. And yes, topical creams are still a problem, have been for a long time, but some of these systems that link together, if you've got some of the medication systems that link with the care planning systems, that's easier to manage. But it's a big thing. It's a big thing to put in electronic systems into a care home. It's a lot of training and a lot of changing people's ideas of how that should work.
No, thanks for that. I think it's really important. I think going even what you said about the basics, knocking doors, actually chatting to someone and keeping that down. It's recording something simple as that. I think one thing that I've been finding is that a lot of people come into the social care for the soft skills and human skills. And I think those human skills, which we have been doing, should always still continue. And I think rather than ticking a box, actually showing the extras that have been done are really important and really helpful. So I think it also helps regards to that as well. So going back to what Tina said, evidencing the soft skills, the everyday skills that happen are really important. I think it really plays in actually showing who you are. And I think a lot of the workforce who came into it are still doing that, and also helps those who are new to it, especially when we're bringing a lot of overseas workforce as well. Just showcasing those everyday standards that we have as well are really key. So I would mirror that as well. Go on, sorry, Peter.
Thanks, Dudley. The approved supplier list for the digital software equipment, I've just put in the chat. It's there, and there's a whole list of folks on there. And I hope that local authorities are going to stop dictating to providers that they have to use whatever it is, because some of those systems aren't very good for providers. They may be good for local authorities, but they're not very good for providers. So they shouldn't be doing that. And just on that point, local authorities should be introducing their market position statements. They should be putting those together. It's going to be a requirement, and they're going to be checked by CQC. And as providers, you should be asked to contribute to market position statements. They should be a document that works for the provider, not just for the local authority. So if you haven't been asked for your comments, contact your local authority and find out what's happening with their market position statements and get your 3 pennyworth in. Sorry for that interruptions, Tina. Any more questions for Tina?
I think there's one question in the chat box about which software do you think is compliant with the Chloe's. I think on the NHS X's a short supply list, all of them should be. I know PCS are, CareVision are, but do by all means look into each of those suppliers yourself, ask them those questions that you want to ask. I think everyone may have different needs and wants, and see what works for you. So Peter's put down the list there. Most of them will do demos and you can speak to them, they'll be happy. And the best thing of it all is that once you've seen someone, you can also go to your local authorities or ICSs, and there should be funding as well. And you do look out for that as well, which is available. So that would help.
Yeah, and use that funding to get yourself lined up with DSPT or Cyber Essentials, because again, if you're working with a local authority, you're going to need those.
Yeah, and I think another thing with the with this is make sure you've got your Wi-Fi sorted out throughout the whole home. It's the biggest problem that anybody gets that signs up, and I don't think get the Wi-Fi right. The Wi-Fi needs to reach every corner of your home, or
And also as well, just adding to what Tina said, they're actually doing support for those buildings as well. So there is funding for that as well that you can ask for. Social Digital also providing, if you go into their website, they will be able to showcase that. I'm sure that you can find and do ask about funding for support around the actual Wi-Fi as well. So
okay, there's a very interesting question just being asked. Is there any software specific to LD homes? Well, what I would say is that if you've got a specific requirement, it's very useful to talk to the various manufacturers and see how their customer service works. Because what we are seeing is before you buy anything, get some references, talk to other people in the same game. And some of these software providers have got fantastic customer service, and they are amending the software. They've got a room full of 12-year-olds who never go out in daylight, who amend this stuff very quickly to suit the actual needs. And with regarding to learning this, as many of you may, or I guess may not know, supported living homes are rarely covered by any sort of inspection. As of, I think, next year or 24, they are going to become CQC inspected, and that is going to make a big difference around learning disability and supported living. And that will probably come in at much the same time as the requirement for CQC to be able to inspect digitally. So there's a huge sort of market there, a huge need. And I'm afraid that's going to involve some of the older members of the social care team learning a bit more about using IT systems.
Yeah, I mean, most of the systems that are out there for care planning have what they call a relatives gateway. That needs to be, and we've said to PCS, we need the residents to be involved as well. It needs to be a two-way gateway. The relatives can already look at what's going on a live basis. They can check if mum needs turning, has she been turned at 3 o'clock in the morning if they want to, and so can the manager. But I think that needs to be the residents too. And certainly in a learning disability setup, there's a lot of people out there that can support their own care plans, that can write their own care plans, and that can be involved in some sort of way, whatever that is. But again, it's about finding out what they can do for themselves.
thank you very much. I think I'm not sure if there's any other questions. I think, Peter, due to time, I think we've got Skills for Care in. Tina, thank you very much for joining us today. I've been very helpful, and I think you'll probably be maybe getting some calls that will be coming in, but recommendations. And I think we know that the next month and during Christmas is going to be very busy. This is a time where evidencing and where things are missed very easy. So try your best to actually keep on top of the basics. But one thing I would say as well is showcase all the great things you're doing over the next month or so, because I think also as well, CQC don't just like the bad things, they also like to see all the wonderful things that are happening as well. So all those wonderful times as well to sort of help staff, keep them up to date, and yeah, enjoy. Thank you.
Okay. And I am going to leave you now. It's been good to speak to everybody. You've got my email address on there. If you've got any other questions, then please feel free to email me. Okay.
Thanks, Tina.
Thank you.
Thank you.
Bye-bye. Bye.
Thanks, Tina.
Thank you.
Right.
Peter,
Skills.
before you go to Skills for Care, and Skills for Care are actually going to jump on this, I've just put in the chat box, next week, Wednesday, for an hour, we will be having a session on the actual WDF funding, with CQC. Skills for Care will be supporting. I hope CQC is supporting as well. I'm just putting that in the chat box, in with the Zoom details, and I'm sure Laura and Sina will be speaking on that as well. So thank you for split second.
Okay. Who's going to present the Skills for Care info? And do you want me to do the slides, or do you want me to make you co-thingy and then you can do the slides?
It's going to be me, Peter, so I can share my slides. I'll just load those up.
Okay, just let me find.
I just popped a comment in the chat, speaking of digital, that we're currently talking with digital transformation leads who hold the funding for supporting you with digital solutions in your provider services. So, so watch this space, because we are having conversations about exactly those, the kinds of issues that Tina was talking about.
And we, with a bit of luck, in the new year, we will have a real event, a face-to-face event, focusing on software and IT, which will also have demonstrations of not hopefully that sort of demonstration, but demonstrations of how software can help you in your care organization. Right, Laura, over to you.
Okay, so hopefully you can all see my slides on the screen. So following on from Tina's presentation, I'm just going to talk about some of the resources and the free training available to support you, just around some of the areas that Tina mentioned are of particular concern at the moment. And there is a lot out there, so this is just a snapshot. And do go onto our website as well. There's quite a lot more on there, which I'm not going to have time to talk through today. So just a reminder that Skills for Care has a lot of resources to support you to meet CQC requirements. I think of particular interest today is our inspection toolkit. And there's a section in here for each of the 5 key questions. And in each of those sections, there's recommendations and practical examples and resources for each of the Chloes. So if there's a Chloe in particular you're struggling with, you can go straight to that Chloe and see what there is there to help you. And that can just support you better understand CQC's expectations, and as well be able to gather evidence and prepare for inspections. We've also got 2 virtual learning modules you can access as well. There's one on preparing for CQC inspection and one on improving your CQC rating if you currently have a rating that requires improvement or inadequate. They both take about an hour to complete and they cost £15 each to buy. You can access £50 per completed module from the Workforce Development Fund, and that extra money is meant to cover your time spent completing the module. So if you come along on the 23rd of November, if you're not already linked into the Workforce Development Fund, you can find out a little bit more about how you can get your money back. So infection prevention and control. The Every Action Counts toolkit, it's not a Skills for Care resource, but I thought it'd be worth mentioning it today, as I know managers have found it really helpful. So this is a suite of resources just to support you achieve excellence in IPC. So there's some posters in there to help you reinforce messages to staff. There's some digital key cards you can send to your staff, which really kind of focus on key behaviours that you want them to demonstrate. There's some hints and tips as well on what you could be doing as managers, to how you can create a culture where people feel comfortable with challenging non-compliance around IPC, and quite a lot more. So do have a look. And when you get the slides, just click on the hyperlinks and you'll be taken straight to the resources. You can currently access free training in IPC from Skills for Care. Again, click on the link, you'll be taken to more details. And this free training is available until the end of March next year. So any staff who you think would benefit from a refresher, do look into this, it won't cost you anything. And there's also an IPC Good Practice Guide, which has been written by Deborah Sturdy, who's the Chief Nurse for Adult Social Care, and that's very comprehensive as well. So safe recruitment, I saw that was something that was highlighted by Tina. We do have a guide at Skills for Care that can help you make sure that your recruitment processes are safe and fair. And this includes a really helpful safer recruitment checklist, which asks you to consider things like how you can check for gaps and inconsistencies between information given on application forms and that information that's provided by references. It kind of asks you to think about how you can carry out effective risk assessments on candidates where these are needed. So do have a look at that. And the second guide I've linked to on the slide This is around gathering and assessing criminal record information for all applicants, including displaced people. So you can demonstrate that you're taking a fair and consistent approach across all candidates. And we know the CQC expects providers to apply the same recruitment processes for staff recruited from abroad as they do from staff you recruit from this country. But we also know it's really challenging to actually obtain overseas criminal record information, particularly in countries like Ukraine where there's a war going on. So hopefully this guide can help you with that if you are recruiting from abroad at the moment. And finally, just some other resources that may be of help. I know, again, Tina said there's a lack of understanding of the Mental Capacity Act that's being picked up. So something we created a few years ago is just a kind of pocket-sized guide that gives a brief overview of the Mental Capacity Act and the 5 principles that must be followed. And this is really helpful for staff to quickly refer to if they need a bit of a refresher. It's really short, not much information in there, just the kind of key things that you need to know. And NICE has very comprehensive guidance on medicines management, which is really helpful to refer to, just to make sure you're doing what you should be. So there's guidance for care homes, guidance if you're a domiciliary care agency or working in the community. And I know, again, the CQC really welcome hearing that providers are actually using this. This is kind of a big tick if you can demonstrate that. And Skills for Care also have a free course on medication management. Again, won't cost you anything to access, available until the end of March. So it's there for any of your staff who might need a refresher. And something I didn't put on the slide, but when Tina mentions an issue was training not being evidenced effectively, I thought I'd talk about our Adult Social Care Workforce Data Set, or RWDS. If you have an account, that's a free way that you can actually record your training. You can run off reports to show CQC. It can flag up any gaps to you. It can flag up where training's about to expire. So do look into that. Celine, if you could put the link in the chat to the RWDS. And it's just to say a free kind of HR system for you, where you can run off reports. It's easy to use. So yeah, no cost to you. And our contact details. And if you want to register with Skills for Care to receive our fortnightly e-news, that has information about new resources, new events, any funding we have available, just go to the link at the bottom. You can do it through there. Hey, are there any questions about anything I just spoke about? As I say, there is a lot more available. I didn't want to kind of bore you by talking through every single thing. And they were the kind of main things I know we're going to link to what Tina was going to be speaking about today.
Thanks for that, Laura. I think you're selling yourself short. I think Skills for Care are involved with so much. There's lots of events happening. Laura, as well as Selena, are sharing information constantly of events that are happening. There's lots of training, also access to articles I've written for them, and also as well, things are shared as well. So you can get involved. There's also funding, rafts of information that constantly comes out. If you're stuck or not sure where to go, you can contact ourselves or people like Selena and Laura who put you in the right direction as well. So do bear that in mind. So I think there's a lot going on, but it's always a good reference point if you go onto their website to try and find something.
Yeah. On the training front, Croydon College have got a very wide range of 1 unit distance learning courses, including meds. We've circulated the details of those. They're on the website, but if you do need any more information on that, just send me an email or send me a text and I'll forward those details to you. And as it's distance learning, it is accredited, but they will work anywhere across London. So just don't have to be near Croydon. And again, with CQC, we're seeing a lot more pressure required on training. And with local authority tenders, now it's quite regular that they ask for a copy of the training matrix to be included with any bid.
I'm not sure if Selena, someone wants to, out of maybe Selena or Laura, want to add anything else that you want to add to to what you're speaking about, or anything that's coming up in the near future that you might want to share to let them be aware? One thing, sorry, go on.
Yeah, no, just to add to Laura's, and as Peter said, we are running a workshop next week on how to get the funding for the training and qualifications, and what you need to do. So if you're not signed up to that, Peter's and Dudley have sent out that link, I think. And it's going to be a session just specifically on that, a shortened session to the usual, telling you how you can access the workforce development funding. So do sign up to that, or miss out, as it were.
And as Christmas is coming in, it's nothing better to do than to actually give some nice gifts back to your workforce by saying that you're going to actually get them on some lovely piece of training, all paid for. How's about that? So yeah, nothing better than that. But no, thank you very much for that as well. I think the other thing that I want to touch upon, I think we have these sessions every month, and I think especially thank you for Peter as well for helping out, and also myself. And we try to get as much information as possible, but we have things such as the WhatsApp groups as well as the emails, and actually sharing information is also key as well. And what I'm seeing is that in some of the groups, people are having issues or concerns at any time during a month, to actually put something out during in the group, and actually people can come back to you and actually give you support as well. Anyone who's struggling as well, it's also a good place in which to reach out as well. One thing we found is social care need to come together as much as possible to really support, because this is what things such as the government are looking at, and really what the sector is doing. So having there's not millions of voices, but one voice, or trying to try and steer where we're trying to go in one place is very important. So please do add into it. We are all trying to help one another, as opposed before it was divide against one another. But things such as tenders or things that are coming up, or support around that, or even how do you do this, are really easy enough to do. Just ask in the group. There are enough people there. If one doesn't answer, some may not, or Peter or I, or even Laura or Sina may actually give you some information and put things in the right direction. So please do use the platforms to assist one another. It's very helpful for that. Peter?
Yeah, I saw in Laura's presentation there was a mention of challenging things like factual accuracy with CQC. If you're going to challenge the FACAC, that's absolutely fine. That's your right. What I would say, because people do ring up and say, can you help us challenge the FACAC? Well, yeah, we can, but you have 7 days to route that challenge. Don't ring up 5 days in. Get your challenge organised, and it is often better to get some professional support with that. And you have 7 days to get that in, and if you miss the 7 days, I'm afraid you're not going to hit the target.
Yeah. Go on, Peter.
I was just going to say we've put quite a lot of stuff in the chat today. There's a Be Winter Ready campaign. That's the representative body for the GB, for Great Britain's energy networks. And they're promoting emergency phone numbers. Should organisations experience a power cut or smell gas, most social care providers should be on their emergency list. And many of the people, if you're a DCA that you're looking after, should be on that list as well. So the link is there for you to add to that. And again, that's something that you can add into your what you feed into CQC, etc., and how you manage your business. And also, many of you will be familiar with the Oliver McGowan training on learning dis and autism. That is becoming a requirement. So there are links to that. Again, we've circulated that, but if you can't find them or you want them, let us know. And we will find out tomorrow, but it is likely that the national minimum wage will rise by 9% from April the 1st next year. If you are particularly a dom care agency working on very tight margins, a 9% hike in minimum wage, even if you're, and I would doubt that many of you are working at the minimum wage level, that is going to make a big dent in your margin, and may well affect the stability of your business. Make sure that you know what your local authority is going to do about managing that increase in your costs, and managing it from April the 1st, not from 6 months after that, because that could well be too late for your organisation. And Dudley reminded me a couple of days ago about the capacity tracker. The capacity tracker, it is a requirement to complete that from November. And I think I'm right in saying that the data has to be sent between the 8th and the 14th. So if you are ignoring that, you may well find yourself being fined, and the fine can be a large sum of money. So you want to avoid that. Dudley.
Yeah, thank you for that, Peter. I think someone said in the chat box that one of your links is not working. So I'm not sure if you can actually get the right link in. If you can't, we will share it out either on the WhatsApp group, or Peter will share it out on the website, and emails that he updates as well. So please do have a look out for that. Also as well, this will be recorded, and we do have I split it out on around everyone to see. So on WhatsApp, a YouTube channel that we have. So all this can be relived again. But yeah, it won't be, it's just the main speakers. So you'll find it's not for everyone's faces on there. So you're happy with that. But no, I think it's very important that Peter's mentioned the updates, which are going to come quite fast and quite a lot during the next month. And we know there's lots of changes with the government, funding. So please do look out for anything. As Peter mentioned, we have things such as the update for the minimum wage rise. We've got things such as the state of care as well. We've got things like the cost of living. There's so many things that are actually taking place. So unfortunately, it's that time of year where it's really just being aware. Another thing I want to touch upon as well is that there are still some live events that are actually happening as well. I will be speaking at an event on the 9th of December, and it's based in London, got a healthcare summit, where there's going to be a raft of speakers around health and social care. So please feel free to come down to there. It's going to be in Angel. It's 9 to 5 on the 9th of December. So there aren't that many events, live events that have been taking place, but this will be a live event where you'll be able to see exhibitors and other things on the day. So if you can, please pop in, and if you see me, do say hello as well. And I'll probably put some details on actually what time my actual session will be. It's about inclusion and diversity, and the importance of actually being included in the sector in your organization, which I think is very important, especially as we have taken on a lot more overseas workforce as well. So just actually making people feel welcome, whether they're whatever age group or whatever speciality or special characteristics that they have as well. Peter will also say to you that we're also now doing live sessions that we're trying to facilitate, and we're looking at doing it in parts of London, from southeast, southwest, and northwest. So if you do know of any venues or things or places that you'd like us to speak at as well, do let us know. We are speaking to local authorities and trying to arrange that. We're trying to do them on a themed basis, so we get actually things in the room as well. So please do share if you would like a topic or subject covered, and we'll do our best to try and get some speakers in place. Both Peter and Sina will try and arrange that. Or if you also want to suggest a speaker that you feel was relevant to us, let us know as well, and we will try and obviously get that arranged. And if any of you as managers that you are here in your areas of speciality and expertise, we also welcome any of you as well if you want to showcase or share anything that you've done or are doing as well. We think is really credible. It's not just your day jobs is probably what you forget about, but you're all experts, I see, and your knowledge and expertise is something that helps the group as well. Peter? I think he's on mute, is he? Peter, you're on mute. Mute, Peter.
What a pillock. Sorry about that. A couple of questions have been raised to me recently about flexible working. There have been some changes to various HR rules, and make sure that you're up to date with these. If you do it yourself, then LCaS is a very good source of information. If you use someone like Citation or Peninsula, make sure that you've updated, and not just updated your policies, but you've passed the information on to your staff, you've told them how that may affect their working. Because if someone leaves and come back to you with a claim, if they can prove or you can't prove that you have told them, then that could be very expensive. And actually just getting involved in that sort of work is not something you want to do, and it costs a lot of time. And policies. You've probably all got 101 policies. It's very difficult to keep them up to date. I see quite a lot of policies that aren't really the property of the company that is saying that they are, because they've borrowed, stolen them from a previous employer, and maybe altered the names, although it's not unusual to find policies with more than one different company name on them. And if you do make your own policies or write your own policies, make sure you've got them right and up to date. Most people nowadays buy their policies in so that they get them updated for their organization on a regular basis. But you must show to CQC that you are explaining the policies to the staff, to the people you look after, and how it relates to them, and also from a staff point of view, how they link into training and staff development, and how you run your staff meetings, etc. And policies are incredibly important. I know it's just more paperwork, but they are very, very important, and it's very easy for CQC to catch you out on those. And as we move into digital inspections, local authorities will also be looking to inspect digitally. My understanding is, and I have taken a legal view on this, is that local authorities do not have the same rights of access to data that CQC do. So before you pass data on to them, make sure that you are doing what the ICO require. And if you've got any queries, talk to the ICO. They're very approachable, and they will give you chapter and verse, and they are the experts. Dudley.
I think there's a question in the box that you've raised a question. Do you have any recommendations for policy providers? And I think, Peter, I know you will mention the likes of Citation.
There's QCS, there's Citation.
And by all means, listen, as a group, everyone can share who they're using as well, what's good for them. And I think one of the beauties of having groups like this is that there's different types of individuals. I know someone who works in HR who actually provides a tailored service for organizations as well. So there are various people who you can use, but off the shelf is obviously very helpful. Know your costs as well. It can be costly. I think I spoke to Peter about this as well. When you are signing up with a lot of these organizations, remember there is a service contract. So therefore you may be tied in for a period of time. Remember, when you do sign up, it may mean that you may be signing up for various years. So do take that into account when you are signing up. So if you feel that it's a service that you're only going to be for a minimum amount of time, it may be more expensive, but maybe looking for the shorter period, because there's things such as 3-5 years. These service contracts are things which are very hard and very difficult to get out of legally.
Yeah, and if you're in one case a DCA, if you're a DCA looking to get a larger office in the same building, then usually the landlord or the agent is quite happy to accommodate you. If you're looking to go down in size from a large office to a smaller office, then they are much more likely to impose the terms of whatever it is, in that case, a 4-year contract, which the client seemed to think was unreasonable, but they had signed it. So the landlord and the agent were within their rights to impose the balance of the 4-year contract. So with all these things, it pays to get legal advice before before you leap into them.
And
Very
I think-
expensive to get out of them.
Exactly. I think one of the sessions we'll be having next year, we'll be probably getting some lawyers in on any legal questions that people have across the board. Because I think there's a lot of concerns when it comes to legal issues as providers in this space and where we stand. So we will be arranging that at some point, and we'll ask questions that you'd like to prepare so ahead of time for any of the legal experts that we'll be bringing in at the time. So but also as well, don't forget Skills for Care are always a good place for when it comes to any sort of information, levels of expertise. You can also then do and have a look and ask Skills for Care. They have a lot of information around even basic policies, and they do support that as well. So please do have a look at what they're providing.
Yeah.
I think it's important.
Iffy has just made a very good point about policy suppliers. They do make mistakes, and it's not simply acceptable to buy in a range of policies, print one of each off, stick them in a box on the shelf, and say that's it. What you need to do is customize them to your use. And that doesn't involve just putting your name on the top. There's a bit more work than that, but those policies may be common to a DCA or supported living or a res home. You need to customize them. So please do, because it's quite easy to be caught out. And the key ones are often the ones that are client facing, you know, back to medication, handing clients money, all this sort of stuff.
I think that's key. I think your compliance and everything that you do, always look into it, because if you've got information and you transferred it over from a DCA to a care home, and then all the information's there, it doesn't read right, an inspector will spot that within seconds, and straight away that's just terrible when it comes to things such as compliance and what you're looking at as well. So please do that. I think Tina mentioned it, and she has to deal with her clients due to sort of small things which can be avoided. So thanks for that. Peter, before we go, because we're nearing to the end, can you just update us with the next dates coming up for the forums? I believe, I know December's busy, and so trying to get people involved with that, and I'm not sure if we've got a January date as well.
Okay, at the moment the only date that we've got definitely is the 23rd. We've looked at one or two dates, but we haven't been able to confirm them yet. So we'll come back in the next few days on those. But we are appreciating that people are very busy around this time of year. So one or two people have said they'd rather move forward. So we are looking at that. But we're having a meeting with some speakers very shortly, which is some interesting topics. So we certainly have a February date. And we will very shortly have a March date. What happens in December and January is yet to be decided. And I see there's a number of contacts in the chat. If it's not clear exactly what's needed for those, I will contact the people after the meeting and find out what's what. So you can leave that with me. And again, thank you very much for coming. I hope you found it a useful session. And finally, Dudley, anything from you?
Look, thank you very much, everyone, for coming. It was a great turnout today.
Thank you.
Please keep doing what you do well, everyone. And please keep in touch. We've got the WhatsApp group. And also, don't forget, Peter also does go to CQC and seeks them at a meeting. So he doesn't just listen and sit here and we all just smiles. He actually does put some of your points to CQC as well. So if there are any issues or concerns that you would like to be raised, please also let Peter know as well, and he'll do his best to try and see what issue concerns that we've raised, that they get to listen to it as well.
Very much. Anything from Skills for Care before we go?
Are you getting all these WhatsApp numbers, guys?
Yep. They're all, I'll just print them off on chat room chat, so it's not a problem. Okay, brilliant.
Well, thank you, everyone.
We'll leave you to it.
Thank
You've
you,
got
Dudley.
2 minutes of your day back.
Thank you.
Thanks a lot.
Bye.
Cheers now.
Everyone.
Bye. Bye.
Thank you very much. Bye.
Bye.
Thank you. Bye.
Bye.
Thank you.
Bye, everyone.
Bye.